These are interesting times we're living in right now, but this is not the first time Toronto has gone through such an ordeal. Today, I'm staying home, and we're going to talk about the history of frontline workers. Not since World War II have we all collectively experienced, struggled with, and forged through a global event such as COVID-19. The health bestowed to many of us has been given to us by countless heroes throughout our society. Today, I'm going to briefly look back at the history of frontline workers in Toronto. Now, one of the most positive things to come out of this pandemic has been a growing appreciation of certain professions sometimes overlooked. The nurses, doctors, ambulance drivers, and others continuously deserve our admiration. But let's make sure to shine the light on the hundreds of other positions that we and they rely on, especially in such tumultuous times. To the grocery store workers, the daycare staff, the support staff at hospitals, at clinics, at shelters, to the people driving them in buses and subways, taxis and Ubers, thank you. Now let me briefly digress. If you're interested in seeing further Toronto history videos in the future, please make sure to subscribe below, give it a thumbs up, hit that bell, and if you have any suggestions or requests of neighborhoods or topics, please leave them in the comment section, also below. Today I will briefly take a look back at the history of some of these groups. Hospitals as we know them in Toronto are very different than they were before. The origins of organized healthcare in the city date back to the War of 1812, with physicians trying to take care of the wounded soldiers. The first general hospital, known as York General Hospital before the naming of Toronto, opened at the corner of John Street and King in 1818, right here, where the TIFF Lightbox is now. By 1818, measles had arrived, followed by typhus. The city was being hit hard with pandemics, killing large portions of our population. The city was growing, and so, clearly, was the need for hospitals and means in which to address the pandemics. By the 1850s, the city would sell off the valuable land at King and John and build the second Toronto General Hospital at the northwest corner of Gerrard and Sumac, close to the Don Valley. This would be the city's main hospital for the next 60 years. By the mid-1870s, Toronto would set up an isolation hospital in Riverdale, wherein patients suffering from smallpox, diphtheria, TB, scarlet fever, and measles would be quarantined, in conditions definitely not up to our current standards. Toronto General Hospital moved to its current location at College and University in 1913, which is now the Mars Building. From here, we entered a phase of great upheaval and change. Both world wars and the Great Depression showed a dire need for a network of hospitals and clinics, as well as a set of schools addressing the need for staffing. Today, nursing is a complex network of skilled workers addressing the needs of many. But the nursing of today was remarkably different prior, having its origins rooted in both religion and volunteerism. The first nursing school in Toronto opened in 1861 on the grounds of the Gerrard Street Toronto General Hospital, the second in Canada. By the late 1800s, women like Dr. Emily Stowe, one of Canada's first female doctors, and other women were pushing for the acceptance of women in medicine and science, with Toronto's Women's College Hospital playing an integral role throughout these early years of the professionalization of nursing. By 1905, efforts were being made to integrate the training of nurses with universities. Prior to this, training was primarily done in hospital training schools. By the 1940s, Canada had 5 university degree programs and 2 diploma ones for nursing. By 1983, Canada had 28 schools offering baccalaureate nursing programs, and by 2010, there were 91. In addition, starting in the 1960s, Canada and Toronto saw the introduction and rise of community colleges and the weaning of hospital training schools. In the mid-20th century, another thing happened to change the nursing landscape: the rise of technology in medicine. Physicians weren't able to safely monitor the new machines, leading to more specialized nursing roles handling them and a broader scope. Now, I chatted briefly with a woman named Libby Grainger recently, and her story shadows that of so many other nurses and their experiences. Libby graduated from the Osler campus of Humber College in 1977 from a 2-year nursing program in Toronto. At the time, she struggled to find work in the city, so she headed south to Texas to work in a hospital. She would head back to North Bay where she was from, bounce between positions, head back to Toronto to work at Sunnybrook, and then back to North Bay. Her 40-year nursing career shadows that of so many nurses, both reacting to where the jobs are at the time, but also the ability to switch between wards and specialties. The wonderful nurses trained in Toronto over the last century have positively impacted communities around the world. Now, countless nurses deserve our praise, but let's briefly mention the most famous nurse in Toronto history, Amelia Earhart. Now, this answer is a bit cheeky, but it's true. American aviator Amelia Earhart came to Toronto in 1917 to visit her sister when she was 20. After seeing the tragic numbers of returning soldiers from World War I, she decided to volunteer with the Volunteer Aid Detachment. She helped the Canadian soldiers in the old Knox College building right here at Spadina College. While in Toronto, she also visited an air show. She would later credit her love of flying to this one afternoon in Toronto. Nurses now in Ontario number over 100,000, with varying roles and positions within academia, healthcare, policy, and now as frontline workers fighting COVID-19. Modern doctors encompass a remarkably different role than they used to. In the early part of the 19th century, doctors were scarce and almost entirely employed by the military. The Medical Board of Upper Canada was established in 1818 and accredited physicians if they had loyalty, integrity, and good morals. The board wasn't, though, capable of vetting physicians arriving from other locales, like the many arriving from America claiming expertise. In 1831, British Dr. John Rolfe, also a lawyer, arrived in Toronto. Rolfe would set up a school and surgery ward at his house on present-day Queen Street between Bay and Elizabeth. He would teach young men his trade, but would lack any means of accreditation. The following decades represented a move from medicine in a home to medicine in a hospital, as well as the standardization of training through the University of Toronto and elsewhere. In 1866, the College of Physicians and Surgeons of Ontario was created. In 1871, 1,177 doctors were licensed, and by 1907, 3,807 were. In 1919, the new Federal Department of Health opened, its first task being to address TB and venereal diseases in the returning soldiers. The Great Depression and World War II would prove to be a great catalyst for change in Canada, leading to the initial attempts to create provincial healthcare plans. When looking at the history of physicians in Toronto, there is one glaringly obvious topic: the discovery of insulin by Sir Frederick G. Banting and Charles H. Best and J.J.R. MacLeod, subsequently purified by James B. Cullip. Banting and MacLeod would win the Nobel Prize in Medicine in 1923, sharing the honor as well with Best. The team would sell the patent for insulin to the University of Toronto for $1. Now, in the midst of the coronavirus pandemic, Toronto's doctors are faced with a situation of significant proportion. For some, they dealt with SARS in 2003. For many others, though, this was always just hypothetical. Now, with such a communicable disease such as COVID-19, the infrastructure surrounding hospitals is immensely important. EMS officials carry a lot of burden during these times as well, carrying being something they're used to, though. Toronto's history with pandemics is lengthy. The isolation hospitals set up during the 19th century to address pandemics would have employees of the Department of Health transport people sick with these diseases, smallpox, scarlet fever, and others, in wagons to the location. In fact, it wasn't until 1889 that they received an ambulance. Paramedics, though, preceded this. The city first hired paramedics in 1832 to address the cholera pandemic. In fact, paramedics in Toronto have been on the front lines of communicable disease for over 200 years, more often than not, directly in danger. As the decades passed, the position grew to include further training, better gear, and of course, fancier vehicles. As I said before, trying to narrow down who frontline workers are right now is a difficult task. The fire and police departments have had to alter their practices as well, often putting themselves in danger. Now, although I am here talking about the history of frontline workers, I also want to briefly mention the efforts of some private companies. Maple Leaf Sports and Entertainment have set up shop at both Scotiabank Arena and BMO Field, cooking free meals to deliver to the city. Our friends at Bosley Real Estate have set up a service where their agents will deliver groceries or drugstore needs directly to you as well as others. So, to those of you manning the helms in shelters, prisons, assisted living spaces, those cleaning and sanitizing things, we thank you. And to those at long-term care facilities, we see how difficult this is, and truly thank you. Frontline workers do not all wear scrubs. They don't all make the same wages. But one thing is clear. We all rely and need them right now. And for that, we are very grateful. For those of you interested in learning how you can help, please consider donating to one of the many food banks currently in need of support. Many people are struggling right now, so please consider reaching out. Friends, family, and even neighbors. Even the neighbors you're not too fond of. Stay safe, Toronto. If you've liked this video and want to see more in the future, please consider subscribing, liking, and if you have any suggestions on neighborhoods or topics you want me to look at, please put it in the comments below.